Tock Seng Hospital is deploying occupational therapists inside its intensive care unit. The move is aimed at keeping critically ill patients alert and emotionally connected. The move targets ICU delirium. That's a common complication when patients wake in unfamiliar settings under heavy sedation. The hospital says this can hinder recovery if it's not managed early.
Delirium is a state of sudden confusion and disorientation, and that really will affect the patient's long-term recovery. Some patients have cognitive impairment that could last for years in different degrees, and this is really important for us to manage early on in the ICU admission. So occupational therapy in ICU can actually try to mitigate this risk and reduce the risk of having delirium in the ICU.
The hospital has also initiated volunteer support in the ICU with its surgical intensive care unit Befrienders program, launched last November. It trains volunteers to provide emotional and cognitive support to patients, offering conversation, music, and engagement to help improve their mood. And to tell us more about these initiatives, I'm joined by Laila, Binte, Abdul, Jalal, who is a senior occupational therapist at Tock Seng Hospital. And also with us is Guan, a volunteer with a surgical intensive care unit. Welcome both of you to the show.
Thank you.
So Laila, let's start with you first. We know that ICU patients may experience delirium. Can you tell us more about this condition and how serious is it?
ICU patients, really quite common for them to have delirium, and it presents with either a state of hypoactive, meaning they are really quite drowsy, not awake, not able to engage, versus someone who is a bit more combative, very confused once they are a bit more awake. Yep. So again, at these both extremes, it's really quite difficult to engage them in activity or even progressive therapy or rehab.
Does someone's age have to do anything with it? For example, do older patients have a higher tendency to suffer from delirium?
Yes, of course. So risk factors for delirium is one of it is age, more than 65 years old. Even the critical condition itself in the ICU is a predisposing factor for them to develop delirium.
Now, Laila, you're an occupational therapist. Can you tell us a bit more about what occupational therapy in critical care, what that looks like?
In Tock Seng Hospital itself, the ICU team, in terms of recovery of the patient, early rehabilitation, it actually takes the multi-D system actually. Yep. So which focuses on like the physical rehabilitation, early mobilization. So this involves the medical team, nurses, physiotherapy, as well as occupational therapy. Having that OTs in ICU, actually we take it a notch further in terms of the rehabilitation focus to cognitive function as well. And the reason is because we know cognitive function directly affects the potential for someone to recover fully or having that functional recovery later on down the road.
Yes. There's definitely an emotional element to it as well, managing the emotions of the patients that are coming out of a critical condition.
Of course.
Can you tell us more?
Yeah, so most of the time when patients are getting out, awakening in the ICU, they get very confused. They get exposed to all this unfamiliar environment whereby there's tubes all over the place. They get really quite sensory deprived, meaning that they're just staring at walls. They are not sure or aware of what is happening around them. Yeah, so that can take a toll on their mood, emotions as well. So we have this therapist on board to actually talk to them, to give some time for them to also be aware of what's happening, which can help with their mood as well.
And speaking of helping with their mood, I want to bring Guan into the conversation. You're a volunteer in a critical or surgical intensive care unit.
Yes.
Can you tell us how you got started? Why did you want to be a volunteer? And some experiences you might have with critical care patients?
I have an interest in ICU things, so that was what got me into it, got me started into this program.
Can you tell us more about your experiences interacting with some of these patients in intensive care?
Interacting with some of these patients is not an easy task, but I try my very best to interact with them by talking to them and engaging with them.
What are some ways that you can bring relief or maybe some comfort to these patients? Is it just conversation, or do you also have other elements that you can bring into the care?
Apart from conversation, we do have some other games like drawing, crayon drawings and all that, but that is seldom used. It's mostly on talking.
Yeah, it's your presence and the personal touch, being there with the patient. That's actually quite important. Can you share about some challenges that you might have encountered when it comes to befriending critical care patients or even communicating with them, considering their condition as well?
Okay, when I look at the me chart, there's the patient's name and the language that he prefers to be spoken. And then sometimes calling out their names alone can be quite a challenge because there's no response like that.
Okay, so how do you overcome that challenge then? How do you connect with them despite
Patience, endurance.
I'm curious, Laila, how you see the role of volunteers like Guan. What role does a volunteer play alongside the occupational therapist like yourself?
Yep. So for the occupational therapist, right, we do assist with like getting to know the patient a little bit more in terms of how to target meaningful activities. So things like getting to know what was their past routine, what they like to do in terms of interest, and this can be actually shared with the nurses as well as the befrienders to follow up on when it's out of therapy. Yeah. So having that befriender, human touch interaction, and awareness on how to actually pitch the right way on how to engage patients, I think that is really meaningful. And it's something that not all of us every day, day to day can do. Yeah, so I really give it to them.
Yeah, and I was wondering about the training required as well, because, you know, for volunteers like Guan coming in, it can feel a little bit overwhelming to have to communicate with critical care patients without any guidance or
Of course,
training. So what kind of training is provided and how will it help volunteers?
Yep. So for our training, we do highlight how to communicate with patients who are non-verbal. Perhaps they are in like breathing tube in their mouth. Also the tone of voice when approaching these patients who need support. A little bit more time, perhaps, rather than going 2, 3 steps or more than 1 step commands at a time. So this gives them the reassurance and also the points to like engage a little bit better.
So Guan have you benefited from some of these tips as well? Can you share maybe an experience that really impacted you, that really made what you do feel very worthwhile?
There was this woman who just had thyroid surgery recently, and no doubt her voice was very soft. She can still manage to engage me in conversation with her for close to half an hour. That makes it very meaningful and fulfilling.
Yeah, when you see the progress and the change and their response to you, that can be very meaningful from the volunteer's perspective. Now, very quickly before we go, Laila, can you also share an event or a moment that was meaningful for you?
So part of what I do is I actually want to promote like daytime wakefulness as well as the attention to engage in something for more than 5 minutes. So I had this patient who had a background of schizophrenia and then she was intubated, she couldn't talk, and she was just trashing about and nobody could actually engage the patient at all. So doing my approach of like getting to know the patient through her family, because at the point of time she couldn't talk, I was able to find out that she does engage in a lot of chats, talking about her experience in community center, doing exercises. So then on, I actually brought in some items that I thought could engage her based on that topics, and she was a bit more calm. And when she was extubated, right, she was really quite engageable. So I think that was an impact that I made early on to engage the patient in ICU.
Yeah, it's very heartening to hear how both of you have made such an impact in the recovery of patients in critical and intensive care as well. Laila, Guan thank you so much for coming in today and sharing your experiences with us. I've been speaking with a senior occupational therapist, Laila, and also volunteer Guan from Tock Seng Hospital.